Welcome to Anatomy of the Knee, where we're going to build a more in-depth understanding of the anatomy of the knee joint, and we're going to include the patellofemoral joint in that as well. And what we're going to do, we're going to start out with the most basic anatomy, and then we're going to basically build it out and build the knee up, starting from the knee joint and then building out into the patellofemoral joint. So things we're going to be looking at are the knee joint itself, the ligaments of the knee, the muscles of the knee. Then we're going to turn into the patellofemoral joint, and then again we're going to be looking at the bones, the ligaments, and then the function, and understand how all that comes together and start to put together a little understanding of our function when it comes to the knee joint and the patellofemoral joint. Very simply, the knee joint is made up of three major bones. There is a fourth one included. So we've got the femur at the top, so that's the big thigh bone. Then we've got the tibia at the bottom, which is the big shin bone, which make up, let's just say, the majority of the joint. Then you've got the patella, which is the kneecap in the middle. And then the fourth bone, which isn't necessarily included within the joint, is the fibula, although as you can see, there are ligaments that attach to it, which is on the outside of the shin. Now, this is a condylar joint. And what can happen at the knee joint and why it's not a hinge joint is because, yes, it is able to hinge. So we can bend our knee like so. And we can also pick the knee up and straighten it. So imagine someone sat down, you can bend the knee. So that's obviously going forwards and back. But what you can also do is you can rotate the knee in both directions as well. It's only a very minor rotation, but it is there. So it's not a classic hinge joint. It would be described as a condylar joint. We're now building out a little bit and including, or in a sense, adding on the ligaments of the knee. And as you can see here, we've got four major ligaments of the knee joint. We've got ACL, the PCL, the MCL, and the LCL. Now, essentially, this is the anterior cruciate ligament, the posterior cruciate ligament, the medial cruciate ligament, and the lateral cruciate ligament. So what we are talking about here are, in some respects, the basic stability of the knee, which is the ligaments. These would be described as a passive stability. As we build out the knee and include muscles in this, we will start to talk about the what would be described as the active stability to the knee, because essentially all that is happening is the femur at the top is balancing on top of the tibia below it. So we've got these ligaments that in some respects are, from a very basic standpoint, holding it on top, or holding the femur on top of the tibia. So we've got, with the ACL, it's preventing the femur from moving backwards. So you can see the ACL at the front here and sort of going across here. So it's stopping the femur dropping off the back. It prevents hyperextension of the knee and also limits the rotation. The PCL, the posterior cruciate ligament, prevents the femur moving forward. So essentially that's doing the opposite. So you've got the posterior one sort of in behind, you can see it in here. And essentially, that's stopping it from dropping off the front. If we move to the MCL, it's preventing external rotation. So we've got MCL, which is medial collateral ligament, which is on the inside of the knee, which is coming down here, which is preventing the external rotation of the knee. So it's preventing the knee from turning out this way, and assists control of internal rotational forces. And then essentially the LCL prevents a large role in limiting external tibial rotation. So we've got all of these ligaments, which are essentially keeping the knee joint in place, and it plays a role in just limiting movement, because as I've mentioned, where we can bend the knee forwards and back, There is also the ability to rotate the knee in small degrees, and these ligaments play their part in doing that. So we have to take that into consideration, and then when we talk about the muscles, which we'll look at next, we'll start to gain a better understanding of where the rotation comes from and what muscles are doing what within the knee.